Hi, and welcome back to my channel. I'm Paige Elizabeth, and I specialize in mindset and wellness these days, especially as it pertains to burnout in women over 35, because it's become pervasive. And I wrote a blog recently. I'm going to paraphrase a lot of this, but we really need to quit calling it perimenopause. HPA dysfunction, nervous system dysregulation, is truly at the core of a lot of the symptoms that women are having. The fact that 30-year-old women are now hitting me up saying, I have these symptoms, tells you it's not perimenopause. And the fact that the Western allopathic model is trying to convince you that it is pretty disrespectful as far as I'm concerned. They're not getting to the root cause of anything. And furthermore, perimenopause is a label, it is not a solution. So let's dive in. So like I said, I'm really tired of everything being labeled as perimenopause or age. Okay, so what do these symptoms look like? We have brain fog, anxiety, weight gain, poor sleep, low libido, burnout, obviously, inflammation, and nutritional deficiencies, right? And then you go to a doctor and they're like, all right, well, you know what? You're welcome to your 40s. This is what happens when you get here. Here's a prescription for, an SSRI, or here is just your hormones. Tired of it. I'm really, really, really tired of it, right? So, most of what we think is perimenopause is actually HPA dysfunction. So HPA, that is hypothalamus, pituitary, adrenal, and that is the gateway to your autonomic nervous system, which regulates sympathetic and parasympathetic, okay? So fight or flight, freeze or fawn, those would be your responses when the sympathetic gets activated, and then you have the rest, digest, parasympathetic, right? So hormones don't cause dysfunction. They are the reaction to dysfunction, right? So it's a signaling issue that tends to happen within the body, all right? So there's basically two types of women that I see, and there's more women than this, but these are the two big archetypes that I come across who end up dealing with HPA dysfunction. Okay, so first is the woman who neglected herself. She lives in survival mode. She ignores hunger, exhaustion, intuition. She's a people pleaser. She's an overgiver, runs on cortisol and caffeine, and doesn't know how to actually rest. Okay, she abandoned herself to survive, and she still is. Okay, the second person is the category that I fall into, which is the woman who did everything right. She exercises constantly. She eats clean. She tracks her macros. She pushes through fatigue. She moralizes discipline, right? But she also was trained to ignore her pain, her signals, and her intuition. Okay, so this was me. That's how I ended up here. And these women tend to get it not quite as hard because unfortunately, or fortunately, I should say, some of the built-in discipline kind of carries them through a little bit. But it's basically two sides of the same coin, essentially, right? So this woman bulldozed her body and called it strength. Yay. It's the same, or two different patterns, but it's the same underlying issue, essentially. So, overriding your body, distrusting signals, living disconnected from sensation and regulation. This is demanding performance from a body that is depleted, okay? So the problem with chronic stress is that when you are chronically stressed, your body cannot take in nutrition. So, and I hear women go, well, I'm have toxic iron or copper. Well, to the body, deficiency and toxicity read the same. Okay, so it's really important to understand that. It's important to understand that when you are in chronic fight or flight, your nutrients are being siphoned very quickly. Okay, so you're going to burn through your magnesium, your zinc, your B vitamins. You're going to completely disrupt mineral balance and impair digestion and absorption. A stressed out nervous system cannot assimilate nutrients efficiently. The harder you push, the faster you burn through your reserves. And this is why a lot of women say, I eat well, I exercise, but my body's not responding anymore, right? So your body's not broken, but it is exhausted and under-resourced, all right? And then The thing about HPA dysfunction is it's not this abstract thing, it's behavioral, right? So like we are essentially a culmination of a lifetime of habits and patterns. So the way that it shows up in the behavior is rumination, over-explaining, constant justification, looping thoughts, anxiety with no clear cause, checking out, numbing, distraction, basically not being able to be present in your own body. So they aren't personality traits. This is what we've done to survive the dysregulation, okay? Your body needs safety. Like point blank, the nervous system needs to feel safe in order to be regulated. Hormones are not the villain. So here's the thing that a lot of mainstream is getting backwards. So hormones are a symptom of the problem. They are not the problem itself. They are the messenger. Your hormones respond to your nervous system tone, nutrient availability, blood sugar stability, mitochondrial health, liver function, and then immune and inflammatory load. So perimenopause is the transition out of your reproductive years, just like puberty was the transition in. You go through more roller coasters hormonally at puberty than you do during perimenopause. Perimenopause is not designed to be a 10 or 15 year era of your life. It is maybe at most 5 years, right? But for most women, it's like 1 to 2 years. Okay, it is not meant to be this like long-standing era, right? And it's not designed to be a roller coaster. So the chaos, the crisis, and the suffering that doctors have decided are normal is not normal, okay? It's not. This is your body screaming that the system itself is not working properly. And the more HPA dysfunction you have, then when you do hit perimenopause and menopause, the more that gets revealed, okay? So, you know, like obviously during puberty, like I don't know anyone who had night sweats and hot flashes, right? Right? Anxiety and brain fog, like maybe anxiety, okay, I'll give you that. But like brain fog, the inability to sleep, again, these are all tied to your nervous system. Functions of survival and being able to cope with reality. I personally think that HRT is being misused for those of us who are not actually shifting out of reproduction. And what happens is, because I believe in HRT 100%, but if you're not having irregular cycles and the ovarian function is not dwindling, then trying to throw hormones at it doesn't help, because again, the dysfunction is coming from someplace else. So if you are in menopause, I totally salute it. But if you're like under 45, I suggest you like maybe look at other things. So in fact, HRT can exacerbate what you're trying to correct if it's actually not the problem. So this is about your relationship to yourself, all right? At the root of this, it's not age, it's your relationship to your body, your signals, your need for rest, your boundaries, and your intuition. If you have spent decades ignoring yourself, overruling discomfort, abandoning your needs to perform, and outsourcing regulation, then eventually your body will say, I can't do this anymore. Not because it's failing, but because it can't do duality forever, right? Like it just can't do this like show up and be something we're not, okay? Healing does require integration and more authentic living, all right? So it's not about fixing your hormones. It's about how did my system get so dysregulated in the first place. So basically the bottom line is that like perimenopause is not the villain. And even if you are truly in perimenopause, you can transition without suffering, without struggle, without chaos, without crisis, okay? These things happening below the surface kick up, right? They get worse during that transition, right? But if you're, especially if you're under 40, like, no, we need to talk about HPA dysfunction. And I am 43 and I was starting to see these symptoms at 40, and we worked between me, my natural doctor, and my TBN practitioner network. We dove in and we were like, okay, I'm not living this way for the next 10, 15 years. Let's get to the core. We did, and all my symptoms are gone. So if you do want more information on this, please like, share, follow, reach out to me personally, book a consultation. I would love to at least talk to you and give you your options.